Hello, everyone. I would like to thank the organizing committee of the 16th UEDA Conference on Diabetes, and particularly my very good friends, Professor Adel Saeed, UEDA President, and Dr. Mesbah Kamal, the conference President. Thank you very much for inviting me to be part of this very prestigious meeting. The topic of my presentation is Reversal of Diabetes, Myth or Reality. And I'll try to give you a balanced overview of this very important and hot topic. When we look at the natural history of type 2 diabetes, we know that it starts at a stage of normal glucose tolerance, then goes to stage of pre-diabetes, from there to the stage of clinical diabetes, and finally to the stage of complications. This we know very well, and we usually think that diabetes is a progressive condition. And the arrow normally goes like this, the yellow arrow you can see going from one stage to the other. And of course, at every stage, you may try to stop the progression of the disease at that particular stage. For example, pre-diabetes, if you take enough steps, lifestyle modification, you may prevent diabetes from coming. That's called as primary prevention of diabetes. What about reversal of diabetes? Now, progression is from left to right. Reversal is from right to left. So once you have reached the stage of clinical diabetes, you can try to come to the stage of pre-diabetes, and from pre-diabetes to stage of normal glucose tolerance. This is what is called as reversal of diabetes. And the right term for this is remission of diabetes. However, kindly note that when the disease progresses to the stage of complications, then there is no reversal. You can see the blue arrow doesn't start there. It starts here only. So if your eye or kidney or heart or nerves are affected, at that stage, trying to reverse diabetes is not possible. So the traditional concept is that diabetes is progressive, it's treatable, but not curable, not reversible. Today, we have proof that in some cases, type 2 diabetes is reversible. However, remember that type 1 diabetes is not reversible, fibrocalcific pancreatic diabetes is not reversible. There are many other forms of diabetes which is not reversible, but some patients with type 1 diabetes, it is reversible. And the rest of my talk, I'm going to focus on that. Now, there are several examples of reversal of diabetes. For example, after severe weight loss, diabetes is reversible. After gestational diabetes, the lady may remit and the diabetes may go away. Of course, it may come back later as well. After doing bariatric surgery, particularly in early cases, complete remission is possible. But even there, our experience has been that after 8 or 10 years of diabetes, it is very difficult to reverse however much weight you lose. Stress-induced diabetes, some acute stress produces diabetes. You get rid of the stress, the diabetes may go away. Drug-induced diabetes, where it's due to steroids or some other drug. You withdraw the offending agent and the diabetes may go away. There are many others as well. For example, at the time of diagnosis of type 2 diabetes, you treat them aggressively and you give them short-term insulin therapy. The patients can often go into remission, and I've seen many such patients do that as well. But for the rest of this talk, I'm just going to talk about lifestyle modification, weight loss, and reversal of diabetes. The correct term, as I already mentioned, is not reversal of diabetes, but remission of diabetes. The American Diabetes Association says, don't use the word reversal, because reversal suggests that the disease won't come back, that the patient is totally cured. That is not true. What happens is it's just going into hiding. It's going to a remission stage. And there are examples of that in medicine. For example, in cancer, any cancer can go into remission for a short time, maybe 6 months, 1 year, 2 years, sometimes even longer, 5 years, 10 years. The patient can be in remission. Spontaneous remission can come, or due to treatment, it can come. But remember that cancer can always come back, and it comes back with a vengeance, and metastasis can occur. Similarly, diabetes remission can also be temporary and is usually temporary, although in a few people it can be for a much longer period. Now, the ADA says, the American Diabetes Association says that if somebody who was on medication is now not on medication, HbA1c is less than 6.5, fasting plasma glucose is less than 126 for more than 3 months, you can say that they are in remission. But other studies like DIRECT and so on have said it should be at least for 1 year before you use the word remission. Now, the diets used, there are two types of diets which are used to achieve remission. The first is a low carbohydrate diet, and the other is a very low calorie diet. Now, if we look at the carbohydrate, In many countries, including India, we take 60, 70, even 80% carbohydrate in the diet. That's called as high carbohydrate or very high carbohydrate diet. If you progressively reduce the carbohydrate intake and bring it to less than 10% carbohydrate, that's called very low carbohydrate diet. And since carbohydrate is one of the drivers of the beta cell dysfunction and for diabetes, if you withdraw it, then the sugars can come down. There's no doubt about that. Also, with very low calorie diets, if you reduce the calorie intake to less than 800 per day, that's a drastic reduction in the calories. A whole day, only 800 calories. Then you will be able to achieve remission. Now, those who practice the low carbohydrate diet will say that only that will work. Those who reduce the calories, they'll say only that works. I think both work equally well. How does this work? When you have a positive calorie balance, which means that you are taking more calories than you are burning. Your exercise is not enough, you're eating more. That positive calorie balance will lead to increased liver fat. And that liver fat will produce insulin resistance in the liver, which is one of the fundamental pathophysiologies of type 2 diabetes. When the fat becomes excessive, it will move to other parts and it will enter the pancreas as well. So the pancreatic fat also increases. Then insulin secretion also gets affected. So the two defects in type 2 diabetes, insulin secretion and insulin resistance, both are promoted by this excess fat in the liver and in the pancreas. So what happens if you have a negative calorie balance? The fat in the liver will begin to melt. It will go away. If you do an ultrasound, you'll see the fat coming down. And then in the pancreas also, it will go away. Therefore, insulin secretion and insulin sensitivity both improve. And that is how you get this remission of diabetes. What is the evidence that diabetes can be reversed by very low calorie diets? Now, when you start giving a very low calorie diet, substantial negative calorie balance, there is a substantial fall in the liver fat, as I told you, and the hepatic insulin sensitivity improves, resistance goes away. If you continue this for 8 weeks, then the pancreatic fat also comes down, and we'll have a look at this in the figures. This is Roy Taylor's work from Newcastle, where he showed that the fasting glucose starts falling within 1 week after starting an extensive low-calorie diet. Then the hepatic glucose production comes down, and the hepatic fat also comes down, the triglyceride content. And for several weeks, if you continue it, there's a continuous fall. And by the time, diabetes is going into remission. And this is experiments done to see after bariatric surgery, both in diabetic patients as well as in non-diabetic patients, you can see the reduction in the liver fat which occurs. If you continue this, as I said, for 8 weeks, then the pancreatic fat also comes down. The pancreatic triglyceride comes down. That improves insulin secretion, as you can see. And that's what I was telling you. But for this, it takes 8 weeks. Did you know that type 2 diabetes is caused by less than 1 gram of fat in the pancreas? That's all you need and to produce diabetes. But to get rid of that 1 gram of fat, you lose about 15 kilos in weight. Only if you lose 15 kilos, that 1 gram of fat will go. Liver fat will go first, and then this will go. Where is the evidence for remission of diabetes? There are many small studies which have been done. The counterpoint study and the counterbalance study and the diadem study and many others. But the direct trial is the best and the largest and most convincing trial. Direct, the name stands for Diabetes Remission Clinical Trial, done by Roy Taylor and colleagues across the UK. And what they did was they took about 300 people with type 2 diabetes. Remember, they took the best case scenario. They took people who are relatively younger, who had short duration of diabetes. They were extremely obese, and therefore they had a lot of weight to lose. They were only treated with tablets, not receiving insulin at all. So all the ideal candidates they took. And they divided them into about half in the intervention arm and half in the control arm. In the intervention arm, they gave them about 800 calories of diet for 3 to 5 months. Now, this is a liquid formula. 1 drink you have, okay, for lunch and 1 for dinner. That's it. Nothing else throughout the day. It's a near starvation diet, except that you take this. Now, when you take this, you expect the weight to go down drastically because only 800 calories for the whole day. And I told you from the liver cycle and pancreas cycle, you expect severe weight loss and for remission to occur. What did the results show? The results showed that in half of the intervention group, 46%, there was remission. So what does that mean? 54% did not achieve remission, even after putting them on starvation. And for 3 to 5 months, only this liquid formula of 800 calories, still more than half could not achieve remission. Also note that 4% occurred spontaneously in the control group. So if you minus that, there's only 42% response in the intervention group compared to the control group. And this, of course, was related to weight loss. You can see that even after putting them on 800 calorie diet for 3 to 5 months, there are many people who did not lose weight, less than 5 kg weight loss. They did not achieve remission. Some achieved 5 to 10, 10 to 15 kg. The remission rates went up. In those 36 people who had more than 15 kg weight loss, 31 of them went for remission. So 5 even then failed. After taking the best candidates, putting them on a starvation diet nearly, 800 calories only per day, they lost 15 kilos also, still 14% did not achieve remission. The reason I'm saying this is it's not easy to achieve remission. People think it's like magic, and social media is talking about this all the time. It's not easy at all. What happened to these people who were followed up for 1 year, for the next year, for the second year? By the time they came to the second year, this remission rate had dropped from 86% to 70%. So 30% are now gone. Whereas 14% are earlier gone at the end of 1 year without remission. Now 30% have converted back to diabetes. So 16% of those who had still having more than 15 kg weight loss, still they were getting back their diabetes. Okay. So the conclusion of the direct study was that if you take the best patients, the best case scenario, make them lose severe loss of weight, give them almost near starvation diet, and then take short duration people who have good C-peptide, about half or little less than half you can get remission, whereas the others it is not possible. Now, as I said, the proponents of the very low calorie diet will say it's only due to the calories. Those who are cutting the carbohydrate, they'll say it's only due to carbohydrate. I think it is both work, but you have to make it fairly substantial for you to achieve the remission. Now, I have coined this A, B, C, D, E formula or mantra for you to remember in whom you can get the reversal of diabetes. A stands for A1C. The A1C should not be very high. If the A1C is very high, let's say 14, 15, you're not going to achieve remission of diabetes, okay? Unless you use short-term insulin or something like that. Whereas the HbA1c is only 8 or so, most of these patients in this trial had only 8, 8.4. They are the ones who are likely to get remission. B is body weight. I told you 10 to 15 kilos body weight loss is necessary. What if you are underweight? Instead of being 60 kilos, you're only 55 kilos. Where is the remission? You're one of those thin insulin dependent, what we call a severe insulin dependent or SID variety. Remission is very difficult in them. So the heavier you are, the more the body weight, the more the chances of getting remission. C-peptide or insulin secretion. If pancreatic insulin secretion is good, then it is not dead yet. The beta cells are not dead. Chance of remission is there. If your duration of diabetes is short, less than say 6 years or 7 years, probably you will get the remission. And lastly, enthusiasm. You have to be highly motivated individual. Otherwise, you're not going to get remission. Because if you're going to give up after 1 month or 2 months, you're not going to get the remission. Also, remember that beyond 2 years, we don't have any evidence. Even by 2 years, it was already dropping off. So we need now 4-year, 5-year data. We also need data in ethnically diverse populations, like, for example, Asians and Indians, where they're already quite thin when they get diabetes. Can you get remission in them? We need the data. Finally, remember that re-reversal of diabetes occurs in a large percentage of patients. I already showed you that in the direct trial, but I'm going to show you that with a clinical case study. What is this re-reversal? Let me show you that. This is a 35-year-old gentleman, had diabetes of 6 years duration. He was treated with tablets and insulin. We put him on a very low calorie diet and a low carbohydrate diet. He lost a lot of weight, was very happy, he achieved reversal of diabetes. He was able to stop all his medicines, insulin, and then maintain remission of diabetes. So we were happy, he was happy, everybody is happy. See the results. His weight came down from 123, 118, 116, 102, 99. Totally has lost 24 kilos in weight. And by losing 24 kilos in weight, he achieved remission of diabetes. Let's see what happened to his HbA1c. 8.4. So again, he's not one of those 12, 14 HbA1c people. This is an 8.4 HbA1c. From there, it came to 7.7, 7.7, 5.6, 5.4 due to the weight loss. So you can see the weight loss is paralleling the reduction in HbA1c. By the time he came to 5.6 and 5.4, he stopped all the medicines. Okay. His liver fat, this is his blood sugar level. So fasting blood sugar came down from 132 to 89, postprandial from 293 to 110, both showing fantastic improvement. Liver fat, if you look at the SGOT and SGPT, SGOT came down from 61 to 16, SGPT from 94 to 20. So what happened to this man? He was very happy. He forgot about his diabetes and he told everyone, I'm cured, I'm cured, I'm cured. We called him back after 3 months and said, please come, we would like to see you. He said, why should I come? I am cured. I have no business to see you now. Okay, don't call me. Stop calling me. I am cured. Don't ever call me back. So we stopped calling him after a couple of attempts. But after 9 months, he himself came back. So we asked him, what happened? Oh, I'm not feeling well, he said. He said, okay, let's see. When we saw his weight had increased from 99 to 112, remember it was 123 earlier. So he lost 24 kilos and now gained 13 kilos. Only half he has regained. So what do you think? From that 5.4, it's gone to 6 or 6.5. That is what you would expect. When he saw his HbA1c, it's gone to 9.6. He has never had HbA1c of 9.6 in his life. Even if he had stayed there without remission, he would have been at somewhere 7, somewhere he would have stayed. But now from 5, it's gone to 9. So you can see from high level to down and from down to high. The body is getting confused now with all these big changes occurring inside the body. What happened to the sugar? 89 fasting became 247, postprandial 110 became 321. It's never gone to 300 in his life. So just like cancer coming back with a vengeance, diabetes has come back with a vengeance. Look at the LFT, the liver function. The SGOT from 16 became 66 and the SGPT from 20 became 152. All the fat has come back. We saw in the ultrasound fat had gone. Now when you saw grade 3 fatty liver, all within 9 months, very quickly the fat can come back. So this is an example of re-reversal of diabetes. And I've seen hundreds of such patients with re-reversal of diabetes, but nobody talks about it. That is the whole problem. So what is my conclusion? You should start conversation with people with type 2 diabetes in targeted population. I told you the ABCDE. So look at the ABCD and identify who are the people in your clinic who are likely to achieve remission. Then start talking to them about it. See if they are motivated. Tell them it could be temporary, but at least we will try. And if you keep your weight down, maybe for a long period also you can get it. Remember that age is a non-reversible risk factor. Family history is a non-reversible risk factor. So that is due to age itself, you can get diabetes. So that you cannot avoid. Then either a low calorie diet or low carbohydrate diet, if followed in a very strict manner, you can get it. But you need support. You need dietitians, educators, talking to them, always motivating them. Otherwise, they lose interest after some time and then they'll come back with re-reversal. So re-reversal of diabetes is a possibility. I'm seeing it again and again. So you must tell people that re-reversal can occur because if you don't come for follow-up, it can be a huge problem. So with that, I would like to thank you all. I'm sorry I'm unable to join you either in person or even in the meeting because of clash with other programs to which I have committed. But I hope this talk has been useful to you. If any of you have any questions which you want me to answer later, you can write an email to me either through Professor Adil Syed or through Professor Mesbah Kamal, and I will be happy to answer them. And I wish you all the very best and wish this conference all success. Thank you very much.